Right now in our community, about 1 in 5 adults experience some kind of mental health or behavioral health crisis at least once in the past year. In addition, we respond to, APD and BCSO respond to about 13,000 calls for service in the metro community.
Based on this information, the Behavioral Health Initiative was created in Bernalillo County and Albuquerque.
It's important because it's allowing us to have resources that we wouldn't be able to have in the field, basically. We have a clinician writing real time with an officer, which is something we've never had in this community right now. Usually we've had clinicians on call, but not real time in the field.
Bernalillo County and the city of Albuquerque have joined together to create the Mobile Crisis Teams, a group that specifically focuses on behavioral health calls.
So the Mobile Crisis Teams are teams that are comprised of a master level behavioral health provider, in addition to an APD officer and a BCSO deputy, and they're available, in the field for any type of behavioral health calls that may arise.
Now, through this collaboration, all of the community's first responders will be working together to solve, treat, and address mental health calls.
So having these teams out in the field allows for individuals to receive immediate care when in crisis, rather than having to go to an emergency room and wait for a bed. They can actually have an evaluation done immediately upon arrival of these teams in the comfort of their own homes a lot of the time.
I think a lot of our patients that are suffering from depression or are having suicidal thoughts, that they usually do have stable vital signs, and they just need to talk to a mental health professional. And so our previous solution was that they would be transported by an ambulance to talk to a physician in the emergency room. And so I think having these teams come to our scenes is really important because they're actually going to get to talk to the right provider at the right time.
There are a multitude of scenarios where the mobile crisis teams can be called out and can assist callers in crisis, as well as their family members.
Perfect example would be, let's say we had somebody threatening to jump at the overpass at Wyoming and I-40. Normally, what we do is we'd have a CIT officer respond to the scene and handle that and have somebody called out from a specialized unit. With the mobile crisis team being in the field, they could respond to the scene and be there much quicker and provide resources that only the clinician has available to them to help resolve that situation quickly and effectively.
When serving a certificate for evaluation from a doctor for someone out in the city or in the county, it can be difficult when you're talking to them through a door. So having a clinician with you, they can kind of help out in assisting on what's going to happen next. If we should stay, if we should go, or if we should just wait around and try and provide more services. The other thing is it'll help us decide if we're going to just do a welfare check.
Let's say somebody's experienced psychosis, but they're not verbally making statements of homicide or suicide. So the officer responding to the scene may not know exactly what to do. They can request a mobile crisis team clinician, and that mobile crisis team will respond to the scene and give them guidance, whether it be a pickup order or whether any other resources that are available to that person. It's all about jail diversion. So if they can provide resources or treatment to this individual instead of taking them to jail to get them help that they need, that's always going to be a positive. The mobile crisis team clinician is going to have access to the providers in the community. They work for a local provider as well. All these referrals will help that individual in crisis get the help they need instead of having to go to jail, because that's the last resort we want to do. If we can divert from jail or even the hospital, that's the best choice.
In situations where the call is violent or turns violent,
normally we'll be dispatched, the mobile crisis team will be dispatched out there. That enhanced CIT officer in the car will be primary. The clinician will be riding with the officer. A second officer will be dispatched as backup. As soon as they determine, the two officers that go to the scene determine that the scene is secure, then that second officer can go back into service and let the clinician engage. If they're at the scene and it turns violent, the clinician will back out and the officers will render the scene safe.
And in situations where the fire department is the first to the scene and it's not a violent or life-threatening call,
we would ask our dispatch center to dispatch one of the mobile crisis teams, and we would wait with the patient until one of those teams arrived. At that point, then back to the initial question, they would be able to provide, a full evaluation on the individual and perhaps prevent them from having to go to an emergency room.
This does kind of help alleviate the whole system as far as taking people to the emergency room that might not need to be in an emergency room.
Which creates a smooth handoff between first responders and the mobile crisis teams.
Once we've ruled out that there's any life threat to the individual, we as firefighters, EMTs, step back and allow the behavioral health professionals to step in and do their magic and perform what they do best.
The MCTs are focusing on parts of the region with the most call volume. They will work shifts that historically have the highest number of mental health crisis calls.
We will be covering the east side and the west side, but the nice thing about this, we will also be able to roam throughout the city and the county.
And are on call for fellow first responders and dispatchers.
Mobile crisis team can be sent out basically in a couple of ways. First of all, dispatch can dispatch a mobile crisis team immediately if they receive a priority 1 or priority 2 mental health call. Or an officer in the field, if they're at a scene of a mental health call and they feel they need a little more assistance, whether it be for resources or to engage with that individual, they can also request a mobile crisis team to respond.
The master's level clinicians that have been hired by our partners at St. Martin's Hope Center provide an additional layer of supportive services.
The goal for the MCT clinicians, the goals are to work with the officers on priority 1 calls to assess, de-escalate with the hope that we're able to reduce psychiatric hospitalization, reduce arrest rates if possible, and to provide follow-up services to individuals who may not be following up with their providers. Well, the idea is for them to be paired with an officer to go out on the call, and so the idea is for the officer to be for them to work as a team essentially. Officer clears for safety, and then the clinician works with the officer in providing an assessment or some type of de-escalation, if you would, in that setting.
Along with their experience as clinicians, they also receive training dealing with crisis situations.
Clinicians will attend crisis intervention training. They'll attend the enhanced crisis intervention training, and then they'll also be on an OJT for about 6 to 8 weeks, training with officers and going out on calls.
When the MCTs respond, the clinicians are the ones wearing the vests, identifying their role on the team.
One of the things that we have ordered are vests to identify them as being part of the mobile crisis team. So it'll say MCT, clinician on the front and back of their utility vest.
For officers and firefighters, this adds a new dynamic to their work as first responders and creates a new layer of community policing.
Yes, that's the nice thing about having a master level clinician. They will add another aspect to it. They will provide more resources. They will be able to have support for the families. We will have better follow-up with our people that have mental health issues. So this is just going to be better for the community, better for the families of people that have mental health issues, and better for those people that do have mental health issues.
We're trained in first aid and medical procedures, but not necessarily in issues that pertain to mental illness. And this allows us now to know that there's an expert in that field on their way, and we can then turn a patient over to that expert. And that's something that has really become, I think, comforting for the men and women in the field, to know that we can take our patient and hand them over to someone who can provide a level of care that we just aren't really equipped or adapt to do.
In addition to the in-field support from clinicians, officers also have the ability to provide information to callers about.
We have an MCAL, which they have a warm line, so if someone that is in crisis and they really don't need to talk to a deputy or an officer or a mobile crisis team, they can actually call NMCAL, talk to a professional there. If it does escalate to the point where the NMCAL counselor believes that they need some assistance, they can contact us, and then we can go out and contact that person and provide the services that are needed. We have a resource guide from St. Martin's. It's a fantastic resource guide. What it does is it gives a lot of information to all the resources that are available to our people that have mental health issues or even our homeless population in the city and county.
If you're interested in joining one of the 4 mobile crisis teams, APD and BCSO leaders say they'll be looking for officers to volunteer.
We will bring in officers from our enhanced CIT pool, and those will be the officers that will be handling the mobile crisis teams. We're putting out a request. Officers can apply, and we will pick from those officers who apply, because we want people who volunteer. We realize that people who volunteer are more willing and will probably do a better job.
Thank you for being part of this program and being part of the Behavioral Health Initiative, which is investing in changing lives and promoting health.
We have identified a need in the community, and rather than just put Band-Aids on it, that we're really working for solutions to actually help our patients get well. I think we know that there's a mental health crisis in the county and in the city of Albuquerque, and we've identified what works and what doesn't work, and we're working towards implementing these programs that actually will work and help our patients.
I'm excited for the future and what these teams could potentially do moving forward, and the expansion of the teams. We've seen a lot of success in just the 4 teams that we have out now. So in my opinion, the sky's the limit on what we can do and provide for individuals in the community that need that extra type of assistance.
For more information about the Behavioral Health Initiative and its programs, you can search Behavioral Health Initiative on either the city or county's website.